1. Do I have a higher risk of getting the coronavirus if I have epilepsy? There is currently no evidence of increased risk of coronavirus infection in people with epilepsy compared to the general population. The risk is increased in people with weakened immune systems, older people, and those with long-term conditions like diabetes, cancer and chronic lung disease. 2. Do people with epilepsy have a weakened immune system? There is no evidence that people with epilepsy have a weakened immune system, therefore they should not be considered immunocompromised or to have an immune deficiency. Obviously, there are individual differences. For example, some people with epilepsy might have a weakened immune system due to coexisting other health conditions and associated immunosuppressive treatment. 3. Does treatment with antiepileptic medications increase the risk of coronavirus infection? There is no evidence of increased risk of coronavirus infection in people taking antiepileptic medications. Therefore, it is important to keep taking your epilepsy medicine as usual throughout any illness. 4. What should I do to avoid the infection? There are a number of measures that might help in reducing the risk of infection. These include: avoid close contact with people who are unwell, hand hygiene, wash hands with soap and water, or use alcohol hand gel, often, especially after using public transport and at any time before eating, cover the mouth and nose when coughing or sneezing with a tissue or a sleeve, try to avoid touching your eyes, nose or mouth if your hands are unclean. Try to keep healthy by following a nutritious diet and taking gentle exercise. Keep your home well ventilated by keeping the window open. 5. What should I do if I have symptoms? At present, it is recommended to stay at home for 7 days if you have either a high temperature or a new persistent cough and you live alone. If you live with others and you, or one of them, have symptoms, then the whole household must stay at home and not leave the house for 14 days. This will help protect others in the community while people are infectious. 6. Are people with epilepsy likely to be more severely affected by coronavirus than the general population? We do not have any information at the moment that would suggest people with epilepsy are likely to be affected more severely by the coronavirus. If a person who has epilepsy also has other difficulties such as reduced mobility, difficulty swallowing, limb weakness and learning difficulties, they are more likely to develop breathing difficulties and to need extra help. 7. Is coronavirus likely to trigger a seizure? There is currently no evidence to suggest that coronavirus will trigger seizures in people with epilepsy. However, infections, fever, particularly in children, sleep deprivation and in general being unwell can trigger seizures in some people with epilepsy. 8. Do I need any specific treatment if I catch coronavirus? You should be able to reduce any flu symptoms with over-the-counter medications. Sometimes doctors may recommend other treatments such as antivirals, antibiotics or other specific treatment. Occasionally these may interact with your epilepsy medication, reducing their effectiveness or resulting in side effects. It is important to let your doctor know which anti-epileptic medications you are taking, the type of preparation and the dose. 9. Will the situation with coronavirus lead to shortages of my epilepsy medicine? The Department of Health and Social Care is working hard to reduce any impact of coronavirus on drug supplies, and we meet with them on a regular basis so that we can bring you the latest updates.